Hello on our Zoom world. Again, I'm Jody Solberg. I'm the president of NGH-WA, and I have the privilege and honor of introducing our Tracy Barrett Adams. She will be presenting the business of medical hypnosis, how to connect with the medical community. Tracy's practice focuses on medical hypnosis for issues like chronic pain and migraine, insomnia, and anxiety. She also works with clients to resolve issues body confidence and sports. So thank you so much for being here with us.
Thank you. All right. Now I'm going to see if I can share my screen and figure out which of these two computers I'm supposed to look at, which I think
You can look at yours. That will be just
okay,
fine.
great. Perfect. All right. So I'm going to see if I can do the sharing. Thanks to that introduction. You said all the things that I would say. I will do a little bit of addition to that, just to add that when I am speaking about my practice, I'm considering us all peers. I mean, whether you're practicing a lot or part-time or whatever it is, I feel like my practice is mostly referral based, and I've built that practice into full-time really quickly. And I'm just going to share my favorite tools for doing that, what has worked for me and what hasn't worked for me. But I also know that I'll probably learn some things from y'all, either from the questions or just other things that have worked for you too. And so I'm kind of approaching that way. My hope is that you will find some nuggets in here, even if you've been practicing for 20 years. There are some things that may be new to you and that you can feel free to ask questions and contribute as well. So medical hypnosis. How can, just in this room, how many people practice what you would call, I mean, I know we've got one person who certainly does. Anybody else doing this as a focus of their practice in the room?
Okay, with the hypnobirthing.
Right, yes, hypnobirthing is, yeah. And, you know, in my practice, I would say that, you know, when I teach, one of the main things that I hear from people is that they might like to do that, but that there's a lot of elements of that are either intimidating or just feel kind of tricky. And so hopefully this, just even after this little hour, everybody feels a little less intimidated and it feels a little more accessible. And not a roadmap, which would imply that there's like some checklist of things that you do that like, aha, there's my practice, but it is hopefully some tools that will help you make it your own. One of the things that I just want to just share a little bit more about my practice. I have about spend probably 2/3 of my time working with clients and then 1/3 of my time teaching. So I teach some different specialty courses, and what's up on the screen now is the integrative medical hypnosis course that Roger Moore and I teach. I've been so honored since he asked me to do this with him, and we do this course a couple times a year, and it's a 12-week course. And I'll talk a little bit more about that later because we have one coming up. So, okay. So doctor referrals, that's one of the things that people, that's the question, the big question, every training we get, even that 12-week course, people are like, when are we going to talk about the doctor referrals? When are we getting to that? So I'm going to get to the thing that the most frequently asked question as we go. When we talk about a referral based practice, we're really talking about what we want is those doctor referrals, but I don't believe that it starts there. What we really want to do is have a mindset of complementing what the medical practitioner is doing with hypnosis, aligning with the medical world enough to be accessible to the doctors or the nurse practitioners, and to be also aligned with our clients so that we don't feel like it's exactly the same. They don't feel like it's exactly the same thing, more of the same. And then we want to work integratively, which really means some version of collaboration. And that, when I say some version of collaboration, that looks really different depending on the provider, depending on the issue, depending on the institution. As you know, I work with hypnosis for childbirth a lot too, and there are some provider. I attended 3 births within a month in the same hospital with the same doctor, and the 3rd time that doctor said, "Wow, I've never seen anything like this." So that doctor was great, but she was not like logging it in her mind that the hypnosis had anything to do with these peaceful, calm, relatively comfortable births. And she was not somebody who was going to want to collaborate with me integratively, but happy to have her patient working with hypnosis. So this, and some providers are like, have the one patient that they call me up and say, how did you do this? What's this like? So the more curious, the more interested the provider is, the more collaboration we get. So when we look, I'm sorry, I'm going through this PowerPoint. I know the people in the room can't see it, only the people on Zoom can. So I'm really making sure I'm saying all the things that are on there. So when we talk about this referral-based practice, we're talking about clinician referrals, but we're also really talking about client referrals, clients who refer to their friends, their family, which is a huge source of referrals. And then, Google and marketing and other things that you might do to promote your practice. These are, I think, less relevant, but because everybody does them and it's whatever you choose to put on the marketing. But I do think how you present yourself and where you present yourself makes a difference. So I'll talk about all three of these things: the clinical referrals and the client referrals, and just the general people who find you on Google. And before we get into it, though, I just want to talk a little bit about some foundational stuff that applies to everybody who's looking at having a medical hypnosis practice. Some things that are kind of foundational perspectives about what we might think we need or really need moving into this field, and how you position yourself. And one of them is medical expertise. One of the things that I hear most often at conferences when I'm going to teach is, well, I really want to work with this, like rheumatoid arthritis, but how do I work with that? I don't really know enough about rheumatoid arthritis, or I want to work with multiple sclerosis, but I don't really know enough about neurological disease to work with it. Some things it's valuable to have some medical expertise in an area. Some things it is valuable to have that, like working with childbirth, where we might be educating, working with, if we're a medical clinician and we might be working with something like menopause, we might be educating as well as doing the hypnosis. But for the most part, the medical expertise that we might think we need to work with, that is less relevant than we think. We want to have, as we look at that medical expertise, the one of the big important things, I think, is your actual background when you start marketing as a medical hypnotist. Meaning, if you have some issue that you have dealt with medically, then you already know you have automatic rapport with whatever client wants to see with that. You're not limited to that, but just as a starting place, that makes sense. Or if you have some real experience with that, whether someone you know or a friend or a family has gone through something and you've been involved, so you really have a sense of what the nuts and bolts of that treatment or therapy might be. For me, when I first started, I knew I wanted to do hypnosis for pain. That's all I thought to myself. And I thought to myself, well, I'm going to do hypnosis for pain at the end of life. And then I found out, I don't really need hypnosis. There's a palliative care doctor who lived across the street from me when I first got certified. And he said, no, I don't think we really need hypnosis for pain. I think we really need hypnosis for helping people live their life better and feel better while they are in this time of coming to the end of life. Oh, so I really shifted my perspective, still keeping it in medical hypnosis. But the other thing, so I also had no experience at that time with death and dying. I had no experience, but I just felt drawn to, other than I had known people who passed away. I just felt drawn to it. But what I dialed into and what really started getting the ball rolling for me was the things that I did know. And I had migraines from the age of 14. So I put that at the top of my website, and I started getting those early migraine clients. I had insomnia from the time I was a kid all the way through my early adult life. And once I resolved the insomnia with hypnosis, I started really finding that I was drawing more clients for that. And I'm not a medical expert on hypnosis, I'm not a medical expert on insomnia. I'm not a medical expert on migraine, but I was able to hear what people were saying about their experience and relate to it. Also, my dad was a doctor, so I had a sense of what doctors are looking for in communication and in presentation and in what might be helpful for their patients. So I knew all of those things, and that was a good starting place. So whatever it is that you are familiar with, whether it's your own sense of connection to your mind body, or your history with doctors, illnesses, or friends that you've had, just kind of dialing into that's probably a place we already have some rapport. It isn't necessary, though, for you to have had an illness in order to work with it. People call me frequently and say, have you worked with this, or have you worked with that? Have you worked with the other? You don't need to be an expert on any of those things that they're asking you about, because you're an expert in hypnosis. So you can trust that expertise and find out whatever it is that you need to know about their particular disease or their particular ailment or their particular type of pain, And the path to that is low-key research, like really low-key. Like you don't have to go and read an encyclopedia about it or know all the things. You can just do a 10-minute Google search and learn enough points to be able to ask then your client good questions. And your client is then going to be giving you the information that you need, and you can learn from them where they are. I work with fertility a lot in my practice, and you can have 10 women with answer the same description of what's going on with their fertility, and they all come in really wanting something different, or often they do. They all want to have a baby, but some not always. Sometimes they're like, I want to let go of this, or I want to not have this be such a priority. So, but having done the 10 minutes of research kind of lets me know some of the vocabulary. I don't have to know everything about it. They're going to tell. And like things like working with chemotherapy, people respond to it differently. I didn't know this, but now I know this. When I first started, I researched what's it like to experience this, and then my clients inform me what their individual experience. The other thing that I think in terms of how you approach your own paradigm is your own biases around the medical field. If you have, and by biases, I don't mean that in a negative way, it's just kind of what way you lean. I have some beliefs about some kinds of things that I have to take into account if they're going to affect my work with clients. I just have to take them into account. But best example, because I see the most people for this is something like migraine. I know that migraine is an issue that can have a lot of different moving parts, and I have opinions based on my own experience with doctors and with my own therapies for it over the years, but I just have to be really careful not to inject that into that. And then last but not least, in the things that count as your medical expertise are things like specialized training. There are some areas where it really does do some specialized training. If you're going to be working with a lot, maybe that's actual courses that you take, or just doing more research, getting a bit more information. It makes sense if it's going to be an area where you are going to put yourself as, I'm the person in town who's really good at this, right? Like, and if you're going to specialize in quit smoking, it probably makes sense to have taken a quit smoking course somewhere. So, and then going from the medical expertise, which you probably don't have and don't need, is the hypnosis expertise. And you have all got the hypnosis expertise that you need. You all know how to listen. You all know how to use the tools that you have to work with clients, whether you've been practicing 20 years or you've been practicing, or you've just not even quite started practicing. You have the basic tools that you need to listen for solutions. My biggest recommendation when we talk about listening for solutions is the trap that it's easy to fall into is, because this is so serious to the person and they may feel something so deeply, it's really hard not to get caught in their quicksand and to be delving more and more into the problem. And we still, just like when we were working with somebody who wants to quit biting their nails, but what's that going to be like? And what do you want your hands to look like? When we're working with someone who has a pain, we want to respect and not be toxically positive about their pain, but we want to draw them imaginatively to how they want to feel pretty quickly, right? So it's not so much about learning more and more about how dire the situation is. And I say this because that's a reframe that we can make pretty quickly. And kind of avoid some of the stories. Again, leaning into your strengths as a practitioner. There's not one way to practice medical hypnosis. There's NLP, people who lean more into NLP, people who lean more into any number of strategies. So whatever that is, you have the thing that you need, and to just keep learning in general. The nuts and bolts, just really quickly, beyond those hypnotic skills that you have, ethics. I'm sure everybody here is practicing ethically and conscientiously, so I don't think I really need to spend a lot of time or any time talking about that. But I think that not only do practicing ethically, but appearing to practice ethically is really important. And it's really important if you're wanting to integrate with the medical paradigm, with conventional medical practice. Because before a doctor starts referring to you, they will likely really look at your website, and they will likely look at the things that you say and what the testimonials say and how things are phrased and how the kind of words that you're using. So of course, you already know that you're not necessarily calling yourself a healer on your website. If you are calling yourself a healer, that's fine. You're probably just not going to attract doctors, but it doesn't mean they wouldn't refer to you. It's it might present an obstacle for a lot of practitioners. But there are statistics in the world about um, hypnosis work for medical issues, and I'm just always careful about posting statistics. Because I don't want to be posting something that a doctor might look at that's not really evidence-based and peer-reviewed by peers that are of value to that doctor. And I also don't like to give statistics of success rates about certain things to clients that sets them up to say, oh, that's going to be my experience for sure, or what are the chances of that? Like fertility is a really good example. There's a very small study done a number of years ago in fertility, where there was a 50% improvement in success rates for IVF for people who used hypnosis. These are just hypnosis recordings. That's a true result, and it was a peer-reviewed study. It was very small, and it was a long time ago. And I do not post that on my website. I do not post that on my website. I might say, if somebody says, is there any evidence, I will say, well, yes, there is this small study, and this is what it's. But I will not put that on there because it begs questions that I'm not equipped to answer or qualified to answer. So if you are, then, or you feel comfortable with it. And I think setting expectations with your clients, along that line, I think we want to make sure that we're setting expectations with our clients and the clinicians that are going to refer to us, so that everyone succeeds. When I talk about how we get those doctor referrals, spoiler alert, it's really the clients. And so we need to let the client be successful, even if they're dealing with a chronic or progressive illness, that they can be and feel successful. What we want to, when we're setting expectations, is to determine what they want, how do they want to feel, and set some intentions to do something that they can feel successful with. We want them to have traction towards what they want. I'm working with somebody now who has a severe ongoing pain issue. We just started working beside each other for the first time this last week, and they, in our conversation, they were really clear. It's like, I know you're not a miracle worker. And I said, okay, but we can leave room for that. We can leave room for that, right? She said, oh yeah, we'll leave room for that. And I said, and you can still make some progress so you can feel better. Would that be okay if you started feeling better? How about if you felt like 10% better? How about if you felt 20% better? And if people are dealing with a chronic thing, 10% better, 15% better is life-changing. Scott Sandlin introduced me to this concept a long time ago, and I really am it's proven to be true again and again. And people who are dealing with a chronic illness find it really refreshing when you not say, it's going to fix you right up. It's going to fix you right up. Now you're going to be all done, because they know that they've probably bought some things or done some things that result in that. Because medical hypnosis with chronic illnesses or ongoing illnesses, there can be miraculous results. Absolutely miraculous. I've seen it again and again and again, but I'm never going to promise a client that. Unlike something like, for those of you who work with smoking, I don't know, then I don't really work with smoking much, because I used to work with migraine and not bothered the clients that the smell of smoke so much. But I do feel like there are some issues that I'm pretty sure, like trichotillomania, hair pulling, we're going to be done with that in 2 sessions. I can pretty much say we're going to be done with that. You're not going to need to do that anymore. With pain, with an illness that's progressive, it's really, if somebody's got MS or ALS, I'm not going to promise them that we're curing their MS, or that we're even going to reverse it, or that we're even going to slow it down. But that we want to find out, how can they feel better, and what it would mean to them, what does feeling better mean to them. Of course, I'm talking about a bunch of different kinds of things here, but measurable change, measurable shift is, again, 5, 15, 20%. That's great. We want more than that. Set our clients up to believe that that's possible, but not to place the bar there, that if they're anywhere not up to that bar, that they're feeling. And just explaining to people the range of benefit. And usually I'll set people up to know that there are these miracles, and then there are people who just use these tools and encourage. Does that make sense? Okay, so we're finally getting to it. I needed to say all that as we were talking about how you connect with the medical community, because the medical community is going to be responding to their clients. So everyone always asks again, how do you connect with the medical community? Do you go and talk to them? Do you go to networking events? Do you send them little messages? Do you go drop off food baskets at their desk? no, you do not do that. That does not work. And I think in some situations, it's actually like not legal to give gifts to medical practitioners who might refer to you. These are the things that do not work. Any kind of cold call, any kind of intro call, any kind of dropping something off at the receptionist desk doesn't work. Anything that smells or looks like you're selling something, because if you're selling it, it reads to medical professionals as quackery. That's what my dad, the doctor, was like, if it quacks like a duck, it's a duck. And he was, adamant about that. And he was a strong believer in hypnosis. He just absolutely, but he hated chiropractors, because chiropractors were always trying to sell in his office. I'm not saying he was representative of all physicians, but I do think this is pretty consistent, a pretty consistent thing that people experience. Not always. I'm going to talk about that in a minute, but again, avoiding making claims that are not evidence-based, whether it's one-to-one with the doctor that you have to who strikes up the conversation that says, well, tell me more. This is not the time to pull out your statistic. I don't think, because if it was a statistic that was really relevant to that doctor, they would probably already know it, if they're curious. And even if they didn't, it's not necessarily going to be your best path. If it is your doctor, though, your doctor, and they get curious and they ask you about it, you can say whatever you want. You already have rapport with your physician. I've gotten a lot of clients from my actual doctors. I was at the dermatologist getting a skin check, a few months ago, and she's like, they have to make that, it's a part of their whatever, their, the training to do some bedside manner thing, I think. She's like, well, and what do you do? And I said, and I thought, sometimes I just say I'm a therapist, even though I'm not. I just like just a quiet conversation when people ask me that. I said, oh, I'm a hypnotherapist who specializes in hair pulling and skin picking. She goes, oh my God, do you have any cards? And that is, I didn't walk into the office and say, oh, and by the way, here's my card, and I specialize in this. She had, we could have gotten through the whole appointment without me giving her a card, but because she asked, it opened the conversation. She got to respond to me and be curious. And so I think if it's your doctor, or you're playing pickleball and the person next to you asks what you do, y'all go out for lunch afterwards, and they say, what do you do? And they're a doctor, and they say, great, they're curious. Or if you happen to be at a networking event or something, and somebody expresses curiosity, great. But those cold calls really help. So here's what does work. 3 things. Happy problem patient. The problem patient who is now not a problem because they are having a change. And it's a combination of that happy problem patient, the curious doctor, and the strategic communication that you do. And the strategic communication is what then brings you to the purpose. Bless you. So what do I mean by all that? Okay. We want to solve the doctor's problem. That's what we mean by happy problem patient. Any client that is reaching out to you through your website, any client that found you or their sister said, maybe you should try hypnosis for this, whatever it is, has probably been in their doctor's office several times. They've probably been sitting there. They've probably been maybe trying different things. And those patients are sitting in their doctor's offices, and those doctors have all different personalities and points of view and perspectives. So some of them are like, really tired of seeing this person, and they just are like saying, well, I'm sorry, there's nothing more I can do. I gotta go. And that's legitimate. I don't know if it's legitimate, but it's an approach. And there are, a lot of pressure in the medical community to finish quickly with people and to not bill for unnecessary tests or what would turn out to be unnecessary tests. And so, but there are also a lot of doctors who are really frustrated because they've tried a lot of different things. And I have seen this most clearly early on with migraine, because there are people who have severe migraine syndromes often just are constantly having some part of their migraine, and also really struggling with having to take too many pain medications, and there's not really an end in sight for them. And so there's a neurologist in Seattle that I'll tell you about a little bit more about her, but she started referring, she had a little list of alternative things that people had to try before she would give them any more, before she would renew their prescriptions. Give them a prescription, and then she'd say, okay, here's acupuncture and this and this and this and this and this, and you got to do one of those things before it's time for your prescription. And fortunately, one of my first migraine clients who had found me just on Google had already reported back to her neurologist that it was a fantastic experience and that she didn't have to, she'd had migraines all of her life since she was 7 years old, and came to see me because she was pregnant and couldn't take her medication right then. And then she had her baby and didn't have to take her medication anymore. And now she was the miracle person, right? Not everybody has that experience, but that was her experience. She told her neurologist. So I was personally on that list because the doctor went back and said that. And this is a client who was really speaking to the curiosity and to the frustration. I mean, my client was speaking to the frustration of that doctor who was earnestly trying to help her patients to find paths off of chronic pain medicine for their headaches. But that doctor's not alone. There are a lot of doctors who recognize they don't want to be prescribing on and on and on. And that's gotten better and more available, more clear a mindset as time has gone on because of what we know about pain medication. So I'm going to talk about the strategic communication, because that's really in addition to the good hypnosis, that's really the thing that you do, is the strategic communication. So the elements of this are to first get your client's permission to contact their doctor. You need to have that. That's on my electronic intake form, and I request that clients I'm going to see for any kind of medical issue that they get that done a few days before our first appointment. So they check the box and they give me the contact information. They never know their doctor's fax number, but I can look that up. And you do need to fax the thing to any facility, any doctor that I've ever communicated with. You can't just send them an email. You can't just drop them a postcard or drop by. Sending faxes, I think the HIPAA respected version of communication, and you can get a little electronic fax number for $6.99 a month. Send your PDF as a fax. And so what I say when I fax the doctor is to let them know that I'm going to be working with their patient. I do not ask permission. I do not say, is it okay if I don't do that. I just say I introduce myself as a professional, as a peer, but not somebody who knows more than the doctor. But I just say, I'm Tracy Barrett Adams. I'm a clinical hypnotherapist, and or hypnotist, depending on where I'm working. And I just fax as a colleague, but not a poser. I'm a hypnotist. I'm working with your patient to shift their perception of pain, or to reduce stress related to their diagnosis, or to help them adhere to the treatment program you've set out for them, right? So whatever it is, however I can sort of spin that at what I'm saying in a way that is true and is also speaking to something that is something the doctor can say, oh, okay, it's great if that patient reduces stress. It's great if that patient will take their medication. It's great if that person feels better with fewer medication, with fewer medicines. So that fax then, when it goes in, what I say in that fax, let me know if you have any questions. I've had since 2011, I've had like 3 people reach back out and ask me a question. Nobody ever asked me a question. I don't know for sure how much they actually even look at it. I think that it might be like, oh, you want to go to a witch doctor? Okay, fine. I don't know what their real take on it is until the patient comes back and talks to them. But I do know that fax, because it was faxed in relation to their patient, is going somewhere in their patient file. They have a record of, they're keeping that. And so every time they look at their patient file, the potential exists that they're going to see my name. And the doctors who are most likely to refer to you, those curious ones, are also the ones who really appreciate communication. I was on a Hypnosis for Pain panel at Hypnothoughts Live about, 5 years ago. And there were several doctors in the room, and I talked about this communication strategy and something to explain working with your patient. And they were all like nodding their heads. This one woman said, I wish everybody would do that. Everybody who's working with my patients would do that. I wish all the massage therapists, I wish they would do that. I wish I would know. And so I don't know why patients don't tell them, but I think that they do appreciate it, and it does make a difference. And it really makes a difference in terms of referral. So the next step of strategic communication is, and this varies. My esteemed colleague Roger Moore, that I co-teach the integrative medical hypnosis course, he does a different strategy than I do. So I'll tell you his, and I'll tell you mine. I do not report to the doctor. Other than that first information, I don't say, well, I saw your patient on such and such a day, and we did such and so, because they don't. know what I'm doing. You know, they don't, that fight there, I mean, terminology that they don't know. And it doesn't, and I'm not, it's out of my scope in my mind to at all measure my client's medical progress, right? That would relate to that doctor. So I don't report back because I think that is not within my scope of practice. I tell my clients, if they're happy, which mostly they are, I say, I would like you to go in your patient portal and drop your doctor a note today about how you're doing. And I don't frame this as advertising for me so that your doctor can refer to people to me, which that is what it is. But I say it's about keeping your record updated. I've let your doctor know we're working together. You need to let them know how you're doing and how you feel about the work we've done. And then they do that. And then the doctor has really come back up in that doctor's frame of a field of vision again. And they have it now, this information in their file, and they're more likely to initiate a conversation with their patient with it in the next meeting, the next time they meet. I used to say, before we had patient portals, next time you see your doctor, tell them. But sometimes doctor's appointments are 2 or 3 months apart, so sometimes that would be quite a lag. The patient portals have really fed that up, and I get more immediate referrals and then more inquiries, and puts that really at the top of the mind. And one of the things that I will do once they've done, I say, let me know when you send that message to your doctor. And then a few days later or a week later, I send another fax and say, your client and I have concluded our work together. And if you have any questions, here's how you reach me. And I again give them my contact information, all that stuff. So that kind of comes back up. And that is very simple, but it has been very effective for me. It makes it easy for them to remember me and refer. So it's not just hypnosis, it's me, the hypnosis. It's not just, oh, I've heard hypnotherapy is helpful. I've heard hypnotherapy with Tracy Barrett, you know, and I think that has been the it absolutely created a pretty clear path for me with doctors. Now there are some issues and some reasons why I think this is particularly valuable and important is that doctors are more and more vulnerable to problems that can come up from is they have to take responsibility for everything, where if they prescribe something that's out of the typical protocol, now they have to explain that if that doesn't go well, right? They have to explain that if their patient has a bad reaction. If the person doesn't know anything about hypnosis, they don't have any background with it, they don't want to have to explain why they suggested it or referred a person for it if it doesn't go well. So knowing that you're a person that they can more comfortably refer to is helpful. Doctors are, you know, again, they have the, you know, whatever the typical protocols are, and then the standards that they have to, if this patient were to ever later on sue them for something, and then they've referred for hypnosis. I just think there's a lot of potential perception, at least on the doctor's part, that this could backfire on them if it doesn't have a real good vibe. So giving them that really good, like, this is what we're doing, and something again that can relate to an evidence-based thing. IBS, I work with IBS, and you all will work with IBS if you open the door at all, because a lot of people have IBS. And the thing I say to people, because this is evidence-based, look like stress reduction related to stress. I don't say we're going to just take care of that. And people, the doctors think that if they can suggest something to their patient that's going to help them with that, and I haven't made a wild claim about it, they're more likely to do that. Once they do start referring, then I reach out to them and try to communicate with them more directly. So if I might send them a stack of cards. If like the doctor that I was sitting in the office with, and they said, "Oh, you do skin picking," and then I gave just handed her some cards. Once I get a referral from one of from a doctor, then I'll want to send them some cards so they have something to hand out, or ask them if they want them. And I would also invite a call or an email exchange, because we're not talking about a specific sort of generally what they can expect. And I like to talk to them, because I like to let them know who to send to me and who not to send to me. Because sometimes that one really super successful client will mean they send people who it's really not appropriate. for hypnosis, or not the ideal client. So I like to let them know who the ideal client is. For instance, the woman I told you about who saw me when she was pregnant and resolved her migraines, the doctor started telling, like, literally people would come in and they say, Doctor so-and-so said that you would make me forget I ever had those migraines. Really? Did she say that? And so, and also her nurse practitioners were also referring to, there were 2 nurse practitioners in that practice, and they were also referring to me. And I don't know what they were saying to people, but people were coming in like, I'm ready. And some people were coming and they were ready to forget they'd ever had their migraines, so they were ready for me to eradicate that pain. And so I wanted to take all those referrals, but I really needed to have to send a little message back to say, here are the things that can let you know this is probably a good referral. I might not say yes to all the people. And that's just because not everybody is set up for success. Somebody's, most classically are the people that looked at her list of all the things they had to try before she prescribed more medicine. And they come in, they'd be, I here for my hypnosis already. And they're really not. Yeah, and I wouldn't, and I don't attribute that to secondary gain. I attribute that to just like anybody who knows that they should quit smoking. My brother said I should come in here and quit smoking, and it's just kind of when people have illness, and it doesn't make them any more likely to be wildly open-minded than to creative solutions than somebody who wants to quit smoking. It's just when people are really ready for the hypnotherapy, they're ready for it. Like any other issue, but it does help just like I would set reasonable expectations with my clients to help the doctors recognize what those reasonable expectations. Sometimes that doesn't work to try to communicate with the doctors. Sometimes it just doesn't work. So I'll tell them. So some of those clients, when I tell them to put something in the portal, I'll say, I'll give them some guidance in how to communicate. Authentic. That makes sense. Are any questions about all of that communicating with doctors thing so far? Yeah. Pardon? Oh, thanks. Thanks. I like that support from the medical practitioner in the room. That's great. So there's another way. There's 3 ways. I said there's the second way of connecting with the medical establishment is through other non-establishment practitioners who are successful or just starting out. It doesn't matter if they're like wildly successful, but people who are chiropractors or acupuncturists or Reiki practitioners are also being sought out by those same problem patients. And so they are a great source of referral. I get a lot of referrals, and they're also just open to things like coffee dates. They're also open to things like, they also go to networking events where they get to meet you and say, oh, you're nice, or, they're much more likely to be up for that and less, and have fewer restrictions on their time and be, their concern about conforming to protocol. I had, and I'll tell you my the secret sauce of this is that I had a little hypnosis recording that I gave to, because I work with fertility and I wanted to work with it more. I gave it to an acupuncturist who, no, not an acupuncturist. I have given it since to acupuncturists, but this was actually a massage therapist who did uterine massage to promote circulation to help improve the potential for conception, which is a practice I know 100% nothing about, but I had worked with a couple of her clients and they really liked her. And so I sent a hypnosis recording to her that she could play during those sessions if she wanted to. And she did. And then I got like just so many referrals from that. And so, so like people you can do that with are like acupuncturists, massage therapists who work with your ideal clients. Some of them are not up for that. Some of them would not want to do that. But I think that having that is one way that you can really make use of a recording like that, where it can bring. I always will say too that for practitioners who are in that sort of paramedical area, they're all like us. They're all entrepreneurs. They're all independent. They're all having to do it themselves and build their own websites and figure all their own things out. And it really is nice. And everybody I've done this with is said a little handwritten note when they refer to. I don't do that to the doctors because that's just clutter. I don't think they care. They send a little hand note. Maybe they would like it. Maybe they would like it. I don't know. But I haven't done the handwritten note to doctors. I feel like it wouldn't make its way there. But I do to those paramedic practitioners, and I think that that makes a difference and makes them remember me when it's time. Let's see. Wait. Okay. So I talked already about your working with your doctor. This is the third sort of path in directly to working with clinicians, to getting referrals from clinicians, is, you know, those sideways referrals that you can get from your doctor that are just, you're just there and you're like, oh, and by the way, and you know, I made the mistake when I was first practicing, and my doctor was so curious. She's like, she sent me a smoker first thing. I don't work with smokers. I really don't. I've never. I guess it's just my colleague Kira worked with smokers, and I was just referred those to her, and she'd refer all of her headache people to me, and it was great. But now there I was with this doctor referral of a smoker, and you know, it was not the best. It was okay, but it didn't yield a ton of other referrals, and I was fortunately or unfortunately seeing my doctor quite a bit that year, and so we ended up talking about what my ideal client is. So I was able to talk. But your doctor, if you have good rapport with your doctor is much more likely to be curious about what's going on with you, kind of because it's their job. Scott Sandlin, who was the founder of the Hypnothoughts website, which no longer exists, but now it's a conference. But one of the things that he did when he was first practicing was through his own doctor, and he did this really sneaky thing, which I haven't done, but it's a really kind of good idea. Was that he said to his doctor, "Yeah, you know, I know you're not into this stuff, but I'm a hypnotherapist, and I'm looking for, do you know any doctors, anybody who I could like talk to about hypnosis who might be into this?" And then he would refer, they would give him his name of somebody, and they'd say, "Oh yeah, you know, this guy or this woman," and then he would reach out to them and say, "Well, I know you might not be interested in this, but do you know anybody else who might be interested in this?" You know, he never made it. He was always clear when he would start the conversation that he wasn't assuming, but those doctors kept referring to him as well because he wasn't like selling them on anything. You know, it's kind of the anti-selling. It's like, "Oh, I'm not going to sell you this, but who could I sell this to?" You know, kind of the Cutco knife version of hypnotherapy, but it did work for him really well. To be clear, when I talk about, just kind of going back, when I talk about integrated medical hypnosis, I want to be clear that I don't mean by that I'm sitting in the operating room putting someone into general anesthesia. That's a different area of clinical hypnosis that I don't do. I have done some sort of similar things in dentist office and some similar things, obviously in some birth environments, but that's really not the focus of my practice. And I wouldn't recommend you thinking it's going to be a focus of practice and get paid for that, because for a while, hypnosis was a real trend, really trending in the medical field. And it's just time and money. It doesn't, I mean, in terms of like surgical things, it doesn't, I don't think there's space for it anymore. In the 70s, my dentist went to a hypnosis seminar of some kind, some sort of hypnosis weekend, and came back and did all my dental work for years with only hypnotic numbing, which was great. And then there was a resurgence of it, I think somewhere in the 90s. And so they were really doing research and playing with using hypnosis instead of with using fewer heavy medications during surgeries. But I think just the difference in client response and in time that it took and really meant that didn't take hold. Nevertheless, there are hypnosis practitioners who do that, but they are usually also already medical practitioners. They're also usually nurses. Seth Deborah Roth does this, but she's a nurse anesthetist to begin with. So, okay. So let's see, I already talked about that. Oh, this is on the line of your doctor. If you are going to, one thing I do recommend, even though I'm not if you're sick, I mean, not if you have bronchitis, but generally I'm just going to my doctor for whatever, some regular checkup or a skin check or something. I do try to show up looking like a professional. I do not show up like I would otherwise be sitting. So again, the path is your clients. So when you are setting up your website, when you're setting up your persona, and I know you all aren't setting this up, so most of you already have thriving practices that are already bringing you clients. But I'd say if you wanted to shift focus to draw more medical referrals, making sure that your online presence is appealing to the patient who has struggled getting the care the satisfying care from their doctor. We want it to be appealing to those clients and also not repellent to the doctors, right? So even though a client might say, oh, I want to go, I'm going to go to a healer who's going to align my chakras. I don't disbelieve in that. It's just, that's not going to, the doctor is going to look at that and go, oh, woo. Maybe, not every doctor. I'm not saying that huge generalization. I'm just saying in terms of stacking the deck job. And then, so that's what you're sending out, like online, on your website, and how you might focus your advertising to people who are going to be drawn to your fresh perspective, but not repelled by your fresh perspective, right? On the medical side. And then when you're listening to really receive what your clients are telling you, to hear their story without, again, leaning into the bias of their story. If they say, oh, my doctor, he just said I just have anxiety. He says I should lose weight. And then he never listens to anything I say, which I hear a lot. And sometimes I say people have long complaints. I'm not going to do right. That's not going to get me any referrals at all if I take that approach. I can totally empathize and see how that person's feelings need to be taken seriously and honored without putting any more of a wedge than already is there between them and their provider. I do pretty often, suggest second opinions if people are really dissatisfied. That's harder to do. I just was working with somebody the other day who's pregnant, and she wasn't able to get in for a second. That is a shame that she's not able to do that just the time. And I don't know, the landscape feels like it changes all the time. But I was working with a client who had chronic migraine. Again, I'm not a medical expert. I don't want to tell this story like I'm a medical expert. I was working with a client who had chronic migraine, and we'd worked together off and on for a few years. And she came into the office and said, yeah, I've just been feeling so tired. And she was breathing. She was breathing. I could literally hear something rattling in her chest. Mm-hmm. And I said, what's going on? You okay? This is quite a few years ago. And she said, yeah, I saw the doctor about it and said this really is nothing. Oh, maybe, okay, but maybe you have another. I mean, I don't remember exactly what I said, but she did. I said, I think maybe this might deserve a second listen. And it turned out she was going into heart failure as a young woman. And it's no wonder the doctor didn't suspect that she was going into heart failure. I didn't expect that, but I think that's as close as I get to giving medical recommendations. And that it's not uncommon for people who are suffering from sort of chronic thing to go from one doctor to the next. And sometimes people don't want to get a reputation for doing that, because that doesn't look good on their medical record either, doesn't predispose the next person to see them in a positive light, but it is nevertheless sometimes capital leads to a more effective care. Okay. Okay, I think just on the last, because that path is the clients, I would say that, also the last but not least on that kind of way to put things up for the clients is that we want to take a layer. I usually will suggest when I'm setting up expectation that it's going to be a layered approach. And I set that expectation up with physicians if they ask about how does it work. This is a question that I'll really answer to physicians if they ask how it works, but I also set it up for the client that it's layers of self-regulation, layers of working with the unconscious perception, layers of releasing whatever's at the heart of that, so that, and releasing the cumulative load of of whatever's been going on, and also maybe really whatever actually started that can release away. I don't say we're just going to go back and release that way, because I don't know that ahead of time. And that way people are expecting, when we look at those measurable shifts, even if people only do the self-regulation exercises I would give them, they're going to experience probably a 50%. pain creates a system in the body, right? It creates this perpetuating system of heightened pain sensitivity. And so if we can dial down what the nervous system is doing, they're going to experience some improvement. And obviously we expect and believe in quite a bit more progress than that. But even if that's depending on what's happening with them physically, mentally, emotionally, they're going to benefit from that. Okay. That is almost it for me. Let's see, I think it is. I have just a few notes again about building, and I don't know if this is, again, probably things that you already know when we look at building those relationships that go from the client to the doctor and then back to us, to let them know that hope is realistic, even if they are feeling pretty bad. I do work with quite a bit with end of life now, and really love doing that work. And so it is really an interesting thing to think about hope in that space. And my colleague Roger works with this a lot. Oh, I didn't tell you, I was going to tell you about the reporting that Roger does it different than I do about the reporting back to. He totally does that. After every session, he reports back sensible things that I work with your patient, and this is what happened, and this is what they experienced. So I will say there's no one right way to handle that. I do not report back, but Roger does, and feels that it's really been helpful. So coming back to this idea, though, of the positive expectancy and what we want for our clients to be able to go into this work with without selling them any snake oil. We want them, invite them to be curious and to kind of have a sense, even if they're not feeling well, of what they should do. So being really clear with what their homework is, if they have some, and be clear on how we're measuring change, so that when they report back to their doctor, they can tell them how they measure it. Right? It's not just, I kind of think that. And then hopefully they will refer more people to, and their doctors will. I'm putting up on the PowerPoint, but you all can't see it here. This is just my website, tracybarrettadams.com, where I have my training software. And I'll talk to you a little bit if you want about the integrated medical hypnosis course that I teach with Roger. And we talk a lot about this kind of thing. We also really talk about approaches to work pretty much in the clinical side. And the course is online for 12 weeks and start in September. And there is a discount code for you all if you're interested. NGH 500. So, any questions? Or anything that you want to share about your experiences working with this? Oh, okay. Well, all right. Yeah, it never actually occurred to me to send a person. I just always felt that the filters would be too strong. You know, like how you write a note to the doctor, you know, Swedish Medical Center. But I'm going to try it.
Block.
Oh, I'm glad. I'm glad. Hey, thank you.
We'll close out the recording. Thank you
You're
so much for joining us. We can definitely stick around for conversation. We're going to close out Zoom for anybody who's watching. And then we are going to have our next meeting in September, so second Saturday of the month, the 13th. Or 14th. Thank you. I was trying to count because I'm going to be so I'll be back a couple of days before. So we'll be here on the 14th. We will be announcing the location. I don't know if we figure that out. So we will be figuring that out, and we will be announcing that it is on the meetup, as well as it will also be on the website. So stay tuned for that. You will also, because you are on the list, you will get the newsletter with all of the announcements of when and where, and what we're doing for that meeting for speakers. Much.
And we're trying to go south